Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. It is September the 15th. This is now 6 months. 6 months we've been doing these twice weekly Facebook Lives. So thank you all for watching and listening. I understand there are some people that have watch parties. That's pretty amazing. Anyway, so as always, we start off with a mask. This is a mask my wife made. And in addition, it's got this little rope thing in the back, so it doesn't go around my ears. I find that pulling on the ears be one of the most uncomfortable parts of masks. So I'll take this off because I'm socially distanced, and we'll start again. So Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Let us know how the sound is, because we've been working on this to get the sound perfect. Great. As always, this is a chance for you to ask questions. We think we've done over 1,000 questions over the last 6 months. But we'll take even more tonight. So as always, we'll start at the top and go down to what's happening in Douglas County. So in the world, still a very active pandemic, 29 million cases and 938,000 deaths. So still very active in the world. We saw this big increase a few months ago, and it really has stayed right up there. Still very active in India, Brazil, the U.S., and pretty much all of South America. So really we're seeing that this is an ongoing, very active disease throughout the Western Hemisphere, except for Canada, which is at a very low number of cases. So Canada, for a country of about 40 million people, they've had 300 or so cases a day, about the same number of cases that we have in Oregon, and yet they've got almost 10 times the population. They actually went a day over the weekend with no deaths. So Canada's done well, but for the rest of the Western Hemisphere, we're really struggling. Still some places in the world that are doing well. I think Australia, New Zealand, South Korea are all doing well. They still have cases and they're still struggling, but the number of cases is very low and not requiring. On the other hand, there are other countries that are struggling. Israel today went back to a 3-week lockdown because their numbers are out of control. France has had a lot of cases for France, about 4,000 a day, and Spain has had a lot, but still Norway and Finland are doing well. Sweden has also seen a low number of deaths. In the U.S., we're at 6.8 million cases, almost 200,000 deaths. Depending upon which number source you use, we're either right at or a little bit over 200,000. Still very active in the United States and Texas, Florida, California, and in the South. We're still seeing a bunch of cases up in the upper Midwest. Illinois and Wisconsin have had cases largely associated with colleges. Deaths are slightly down, but still at 200,000 deaths. This is a very active pandemic. In Oregon, we're at about 29,000 cases. We're likely to hit 30,000 cases this week, and we hit 500 deaths. We're at 511 deaths now. Now, still in Oregon, this is the 4th lowest attack rate of any state. So if you look at cases per million for the different states, Oregon is still very low, and the only state with more than a 2 million population to be at this low rate. And the death rate is still in one of the 6th lowest. Douglas County is still doing even better than that. We're up to 193 cases and 3 deaths. You'll notice over this last week we've had a far more than our typical number of cases. The week before we had just 3. This week we're up to 8, and this week will be even a little higher than that. These come mostly from out-of-state travel. So we have a person in Ohio and a person in Massachusetts, Douglas County residents who were in those areas that got sick. And then we've had 2 gatherings that have led to a bunch of cases. These are older people, and older people much more likely to get hospitalized. So now we have 5 hospitalizations. It was time last week we had 0. So really, 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 we need to be careful about this. The 5 hospitalizations are all moderately ill, so we're very, very cautious about what's going on. We're really trying to track down their contacts, but as we track down their contacts, we're finding more and more cases. So still, although we've avoided it in Douglas County for the most part, this has been a treacherous week. Okay, we'll take some questions. So has the curve flattened in Florida? Unfortunately not. So when I looked at the Florida curve this morning, the numbers go up and down, but really hasn't flattened very much in Florida, and the number of deaths is still really quite high. So what is Canada doing differently? Well, Canada did 3 things differently. One is that they rather than doing this on a state by state or a province by province, they did it as a nationwide area. And as a nationwide area, they did a lockdown about the same time we did it. Their reopening was a little quieter, and they never had the huge amount of hidden disease around. They've always done a fair amount of testing, and it's just never grown up. So actually what Canada has done is about what Douglas County has done, and we're seeing in Douglas County in Canada about the same thing. So when you let this get totally out of control, like it did in New York, like it has in Washington, it's really hard to stuff it back. When we get a new case, we can get right on top of it. So to give you an example, Massachusetts, where they've had a lot of disease, we had one of our people who was in Massachusetts and got sick, and I called them. They hadn't even started on this yet, and we've been on it since Saturday. So I think Canada started the lockdown. They had a national approach, and they never let it get out of control so that they could now monitor it. Interestingly, also, Canada had an interesting economic approach. They recognized there would be unemployment, so they did stimulus checks and enhanced unemployment benefits from the very beginning, and so they've done a good job. So Laura says, are all schools in Douglas County able to open, and are all grades able to return to campus learning? They are allowed to, at this point, do it. It's up to the school boards whether they do it or not. But as of last week, we met the guidelines. This week, the state positivity rate crept over 5, but we don't think that has an effect. And our positivity rate has never increased above 2% in the last month. So we think all the schools can open. Now, some have chosen to wait to reopen. That's, again, their school board's decision. Some have chosen to open right away. Again, that's their school board's decision. So tell us what you think about family and friend bubbles being safe. So this whole idea of bubbles has been a COVID era concept. And so the biggest bubbles are the NBA bubbles. So the NBA is now near the finals. And they've done a good job. What they did is all the people from the NBA went to resorts in Florida. They did extensive testing day after day after day for these people until they got that there was nobody positive. Nobody came in, nobody left. So you were sort of stuck in the bubble. And not surprisingly, there was no disease. Bubbles for a place like the NBA where you have pretty much all the money in the world, you can do. The football teams have also done these bubbles where they've tried to keep people in the bubble, and they've done okay. Baseball has allowed people to be at home and go out to parties. They've done a little less well. So the tightness of the bubble really makes a difference. So the story is that you and your family are together, you're all together, you never leave the house, you go 14 days without getting tested, you'll be very safe. But the bigger the bubble it is, the more likely that somebody's got to go to work, somebody got to go to school, somebody's got to go out and do the shopping, and then that bubble is pierced. So again, though, being in a stable group where you don't have a lot of other contacts is a very safe way to do it. So Mary says, when should I get the flu vaccine to have the best protection? Well, you should get it exactly 2 months before it arrives in Douglas County. Well, since I can't predict when it's going to arrive in Douglas County, anytime from now on, you should get it. So what happens with the flu vaccine is you don't have much protection for the first 2 weeks. You have rising protections between 2 weeks and 4 weeks. You have very strong protection from 4 to 12 weeks, and then it starts to go away. So that's why you don't want to get like a year in advance, but getting it now in the second part of September, a perfectly good time to get it. Yeah. So Amy says, can you discuss the AstraZeneca vaccine trial restart? What made them decide it was safe after a volunteer got transverse myelitis? So let me go back on this one. So AstraZeneca vaccine is made with the drug company AstraZeneca, a company that makes lots of vaccines, and Oxford University. It is it's one of the leading candidate vaccines. They did the phase 1 trial. Apparently there was something in the phase 2 trial that caused them to halt a little bit, but they didn't tell us, and that worries me a lot, because really on this, I really want people to be open and honest with what goes on. In the phase 3 trial, there was a person in the United Kingdom who got a syndrome called transverse myelitis. Transverse myelitis is a rare thing one or two per million. So that means in Oregon we have a handful of cases a year. It's a weird thing where all of a sudden your spinal cord starts to have this inflammation and you start to get weakness or paralysis from the area where you get transverse myelitis. We don't know what causes it, but it's usually thought to be related to an immune reaction. And so when you get that after getting a vaccine, it's a little bit worrisome because remember, it's rare and it's immune. So when you think of this thing, now it could just be luck that you could get it this way, but it certainly could be related to the vaccine. And that's why you'd want to have enough people to know. Remember, it's only a few cases per million. So if you only gave the vaccine to 30,000 in the group and only half of those got the vaccine, only 15,000, you wouldn't expect to have even any cases. You might have one or two cases of this, but they should be on both sides of the trial. They decided in the United Kingdom to reopen the trials. The United States has not reopened the trials. But again, the strategies for when you should close, when you should reopen, we really need to be honest with, because if we're not honest with people about the vaccine, they're not going to want it. And you can have the best vaccine in the world, if people don't get it, it isn't going to work. So I'm not privy to the decisions to start or stop this, but I was shocked actually to see that they restarted it. And they could have said we restarted it because we found that the person who got the transverse myelitis actually had something else. They had a bacterial infection, or they had, or we found they had multiple sclerosis, or actually they were in the placebo arm of the group. I'm not sure how they could decide so quickly to restart. Yeah, so Veronica says, do you expect some cases from all the people staying in groups like at the fairgrounds? Yeah, we're very worried about this. There are 3 or 4 things that are happening at the same time which we could do. One is there's a lot of grief. So 109 houses gone. I mean, that's awful. And 255 people have lost their houses, as well as hundreds of others that are displaced and living at the campgrounds or whatever else because they can't get back to their houses. So it really is a tragic time. And during that time, a few things happen. One is there's a lot of hugging going on. And hugging, obviously, very close contact is a risk. The second thing that happens, people are living with other people, making their households bigger. So my son, who lives up in Walterville, his house didn't get burned. It was just around it. But he's now living with friends in Springfield, so a much bigger house now in Springfield, which increases the risk of spread. The third thing that happens with this is that people travel from one area to another, right? So they're burned out of somewhere else and they come to Douglas County and they can bring in disease. So for those reasons, we really are worried about the increase in cases. Now, the increase in cases this week, we think are not related to either the Labor Day holiday. Most of these people were sick actually before the holiday, and there was not a lot of travel involved. The other thing that we worry about is the fires, and again, we haven't seen any directly related to the fires, but we're holding our breath because we think in the next few weeks this could happen. Okay, so some interesting things in the news. There's this thing that you may hear about, a thing called nanobodies. And nanobodies is one of the most fascinating things that has come out during this COVID pandemic. So most mammals make antibodies against things, and these antibodies look sort of like those whirligigs that you see elsewhere with 2 things coming up and then some wings coming off. And those are usually large. They're hard to make in the laboratory. They're not particularly stable, but they're very good at fighting infection. They're a little bit hard to give because they typically need to be given either intravenously or in a big slug, and they're expensive to make, typically thousands of dollars a dose. Well, what they found is that camels and llamas, how in the world would you know this, that the antibodies that camels and llamas produce are tiny. They're really tiny, they're really stable, they're much easier to make in the lab, and they kind of work like antibodies to go ahead and bind viruses. And when they bind viruses, they bind very strongly so that they stay bound for a long time and could prevent these viruses from making you sick. So when you hear about llamas, maybe the answer here is because you could grow these nanobodies in llamas and in camels. You can then attach them to yeast and you can make them fairly quickly along the way. So nanobodies probably won't be ready in the short term for this, but in the long term may be an incredibly interesting way that we can treat disease, because it looks like the llamas will make these nanobodies to almost any germ, and if it works, you could imagine having this big panel of nanobodies out there available to give people who get all kinds of different diseases. So that's interesting. A couple of things came out in terms of treatment. More studies on remdesivir, and again, remdesivir looks like it's going to be pretty good. It decreases length of stay. It may slightly decrease mortality. So remdesivir looks like it's going to be okay, but not great. More studies out on Decadron. Looks like it can decrease mortality for people who are sick, which is great. There's a study about a thing called Baricinatib, which is Baricinatib, which is a JAK1 and JAK2 inhibitor. So in your body, when there's inflammation, your body sends out these proteins that tell other cells what to do. So it's like this information system. Like, how does one cell tell another cell what to do? Well, it does it through these kinase proteins, and Baricinatib can inhibit those and may help with the cytokine storm. There was a study that suggested it may slightly decrease length of stay, may slightly increase the level of health in people who are quite sick. Again, not a home run, probably more like a bunt, a single, or a walk, but could work. And then another hydroxychloroquine study. What would our day be without a hydroxychloroquine study? So at the end of last week's thing, somebody talked about a Belgian double-blinded study on hydroxychloroquine. It is not a double-blinded study. So a double-blinded randomized controlled trial is when neither the patient nor the doctor knows what you get. Some people get the drug, some people get the placebo. It is considered to be the highest standard for looking at this. This was not. This was a retrospective observational study. So they looked at about 8,000 people who had COVID, and they looked to see which ones got hydroxychloroquine and which ones didn't. Turned out that the groups were quite different. So more younger people got the hydroxychloroquine, more people 80 and above didn't get the hydroxychloroquine. There were fewer deaths in the hydroxychloroquine group than in the other group. It's not a placebo group, than in the non-hydroxychloroquine group. So hard to know, right? So when you look at the number of people over 80, almost twice a high percentage in the non-hydroxychloroquine group. So hard to know, since most of the deaths were in people over 80. It's really hard to know. They said they did a multivariate analysis. So a multivariate analysis supposedly takes all these things into place, but they didn't. I mean, so they said they did one, but I can't find where the multivariate analysis was ever done. So again, more confusing data. There are some good randomized control studies about hydroxychloroquine. Unfortunately, none showed any help. There's a study about ivermectin that may be coming out. Again, we've been waiting for it for about 4 weeks now, for this incredible study on ivermectin that people are teasing us with, and yet we haven't seen any data, so I don't know about that. So Stacy says, if you get the flu shot now, could you get another flu shot in the beginning of the year? There's nothing saying you can't, but it's not recommended that you get more than one flu shot, except for the first time you get it. So the very first time you get a flu shot, if you're 6 or 9 months old or 3 years old and you've never gotten one before, you usually get one and then repeat a month later. There are people who inevitably get 2 flu shots in a year. They forgot they got it the first time or whatever, and it doesn't seem to cause any harm, although it's not recommended. So Lee says, there are articles suggesting the universal wearing of masks is increasing asymptomatic cases and reducing severity. Can you speak to this? Yes. So the story on this is that we think that some of how sick you get from a disease is related to how much disease you get, how many germs you pick up. So we've always known in pediatrics that the first kid in a family with chickenpox gets it bad. The brothers and sisters who have a lot of contact with them get it much worse. Similarly, it was known with smallpox that you could do a thing called variolation, where you'd actually use just a tiny bit of the smallpox, and you'd inject somebody else with it. This was before the cowpox thing, and they would have less of a case. In fact, that's what the U.S. soldiers did at Valley Forge and to prevent them from getting smallpox. So you know that if you give somebody a tiny dose of the disease, they're much less likely to, they may still get the disease, but they're much less likely to get sick. So there was an intriguing article this week that said using masks may be causing people to get a much lower level of the virus. When they get a much lower level of the virus, they are able to get a very mild case, in fact, so mild that they may be asymptomatic. And that then could be a way we could control the disease if everybody got that way. It's intriguing and certainly could make sense and wouldn't be shocking. I just don't think we have enough data to show that's the case. What we do know is that wearing a mask, and if everybody wore masks, we could decrease transmission, and that would be great. So I'm encouraging everybody to wear masks when you can't maintain social distancing, as we're doing here, and you're outside your family group. Okay, a couple more things came out about testing this week. So I think batch testing, that's where you would do a bunch of samples at once, and then batch testing has been shown to be really quite effective. That could be great, especially if we use saliva, because people are totally happy to give you a sample of saliva. And so you could, for example, imagine on a sports team, everybody spits in the bucket at the beginning of the practice. By the end of the practice, you could tell if anybody on the team is positive, and if they are, then you could use some of the original sample to go ahead and sample the individual players. That would be ideal. There's talk about using a saliva test at home. So again, my dream of having this test where you spit in the cup before you take your shower and know by the time you get in the shower whether you're positive or negative. I think those things are getting closer. The other one is stool testing. I was at a conference today, and the state is, in conjunction with Oregon State University, is sampling the sewage effluent from 40 different places around the state to see if there's any virus in there. Now, we know that the viral particles are in the gut. So if you look in the poo of people who have the disease, you can find some of the viral particles. We don't think you could ever find a virus, but we can find some of the RNA that's there. And then if enough people use the sewer system, RNA is really pretty hard to degrade, and so it makes it through the sewage treatment. So if you look at the sewage that's there, you can actually find this RNA and you get a sense of how much disease is in the community. And the state has done this a few times. You remember there was a big outbreak around Newport in Lincoln County, and they had very high levels there, and then as they got this under control, the levels of RNA went down. One college has used this in each of the dorms, and they could find that one dorm had a high level of RNA before anybody actually even knew they were sick, and then they could go ahead and look at the people in the dorms. So some exciting stuff coming out there with testing, some exciting stuff coming out there with saliva. Unfortunately, these are exciting things that are out there that are not really yet quite ready for prime time. Still, the testing we have now is pretty rickety. You know, there's the deep swab in the nose. We think that's very accurate, but still but uncomfortable to do. It takes 2 or 3 days to come back. There's the more rapid antigen testing, which is from the front part of the nose, where you get the results in 15 or 20 minutes. But what we have seen over the last few weeks is that there's some that test positive with that, never test positive again. So maybe a false positive test. And then there are others that test negative with that, but then when you do the more accurate test, they test positive, so some false negatives. So we think the rapid testing is maybe okay, but with some false positives, false negatives, not great. Because if it's false positive, we tell you you're positive even though you may not be, and you're false negative, we say you're good to go when you're not. So again, there's lovely testing things that are out there in the media, but actually what's available now, not that much different from where it was 4 months ago. So Tamara says, is COVID easier to get if you're exposed to wildfire smoke? We do not know. Now, what we do know is that people with underlying respiratory disease are really being hampered by the smoke. This level of smoke is huge. Douglas County usually has some of the greatest air in the world, PM 2.5 levels. So PM 2.5 are those really small particles. I check it almost every day. I'm such a nerd. I check it almost every day. And the numbers, like 6, 8, 10, 13. It's some of the clearest air. It's amazing on some of these clear days when you fly. Remember flying. When you could fly out and you could see all of the Cascades all the way up to Rainier in the airplane. And it's hundreds of miles, such incredibly clear air. But now the levels were huge. Over the last few days, it was over 500, which means that you could barely see the mountains behind us. And so this smoke is really, really hard on people, especially if they have chronic lung disease. Does it make it easier to get COVID? We don't know. That would be a really hard study to know. What we do know is there are a lot of people who are coughing, and they've got tickly throats, and they've got a cough, and it's really hard for them to know if they have COVID, because some of our people with COVID have just had a cough and a tickly throat. Similarly, there may be people who have COVID, say, it's not COVID, it must just be the smoke, because all I've got is a tickle. There are a couple of things that you should never get from smoke. You really shouldn't get any GI symptoms, nausea, vomiting, and diarrhea from smoke. You should never lose your sense of taste and smell from smoke. You should really never get a fever from the smoke. So if you have one of those things, it certainly could be COVID, and you should get tested. Okay, so we'll take these 3 questions here. So in public setting where people are close, would having strong air circulation disperse the virus, or would it spread it to more people? And that's always a question that we have, is that when there's more air dispersal, are you more likely to spread it further, or are you less likely to get it? I think all of the data suggests that the more air circulation, the better. So that when you look at places that have poor air circulation, moderate, or high air circulation, the risk of disease goes down and down and down. So it's been very interesting. If you look on buses that have terrible air circulation, lots of disease on buses, not very much air circulation, not much disease on planes where they have lots of air circulation. So we generally think that the more air circulation, the better. And the question is, does drying the virus make it inactive? We think yes. So we think that typically this virus is on droplets. When those droplets dry, those droplets then dry and the virus falls to the ground. We think that's the case. Although there are a couple of interesting things with this case. Typically, the reason that these viruses don't spread a lot in the summertime is because of the summertime conditions. This virus is not following any of the rules, so I don't think I have enough data to tell you yes on that. So, will the hazardous smoke levels hurt small children, and is it permanent? So, we have a lot of experience with people breathing in smoke, and those are people called smokers that breathe in a lot of particulate matter, and we know that smoking over a long period of time, so it's the amount of smoke and the period of time that does it. So when we look at a smoker, 50-year-old come in, you say, well, how much have you been smoking, and for how long have you been smoking? And so he goes, I've been smoking 2 packs a day since I'm 10, which is usually the story we get. So he's, for 40 years, has been smoking 2 packs a day. He has 80 pack years. And so that's a lot of smoke exposure. And that person, high risk for emphysema, high risk for lung cancer. We think that the smoke levels over this last week have been about the equivalent of smoking 10 or 20 cigarettes a day. It's a lot. I mean, there's nobody in the world I would recommend to smoke cigarettes, but the amount of smoke that you've gotten if you're outside and active was maybe the equivalent to 10 or 20 cigarettes a day. Somebody said 20 packs. I don't think that's right. I think it's 10 or 20 cigarettes. So if we've done this, and let's say it goes on for 2 weeks, you will have a 25th of a year, 2 weeks out of 52, a 25th of a year for a pack. So you'll have like 0.25 0.025 pack years. Not a lot compared to the 80 of the person who's smoking. On the other hand, no smoke level is good, and this smoke level is not good for you. I think people will cough and wheeze if they otherwise then don't pick up smoking and whatever else, and we have our typical great air in Oregon. It's not likely to cause any long-term problems. Still, this is a lot of smoke. I mean, when I look out the window here and you can't even see the trees across the street, that's incredible. I was in a Home Depot the other day getting something. You could actually not see the other end of the store for all the smoke. That is really awful. So we really need to get this under control. The weather forecast is over the next several days. There's a front coming in and it'll come down. Actually, the smoke level in Roseburg is lower today than it's been in the last few. So Zach says, when's the best time to get the flu shot? Exactly 2 months before the flu arrives. But since you can't predict when the flu is going to arrive, get it as soon as you can. So how is Sweden doing after ignoring the virus at first? And so this is fascinating, and I think the whole Sweden experiment is interesting. So again, and I don't ever remember my geometry, but if you look at the map of Scandinavia, there's Finland with about 5 million people, Sweden in the middle with about 10 million people, and Norway closest to the Atlantic with about 5 million people. Sort of similar cultures, not exactly the same, but Norwegian, Swedish, and Finnish culture about the same. And if you look at Norway and Finland, they've got about the same population as Sweden in the middle. So really, if you're going to do a combination, this is what happened. Sweden took sort of a laissez-faire approach. Oh, let's not do much. Let's go ahead and just let this virus sort of move through and get herd immunity. And Norway and Finland took, like much of the rest of Europe, the lockdown and restrictions on movement and whatever. Now, what Finland did was not totally laissez-faire. What Finland did was not quite as strict as Oregon, but certainly not nothing. I mean, they did ban big gatherings and they did some things along the way. So what has happened there is that Norway and Finland have had a few hundred deaths between them. So I wrote this down somewhere, but a few hundred deaths between them. Sweden has had 5,800 deaths. 5,800 deaths, so about 10 times the number of deaths as Norway and Finland combined. So they had a lot of deaths among seniors. At this point, all three of the areas have low rates of disease and low rates of deaths. Hard to know what that's about, right? But they all have, and they've all opened up. So at this point, they've all opened up. They all have low rates of disease. They all have low rates of death, about the same between them. But Sweden has 5,000 more deaths. So I don't know what you make of that. When you look at the unemployment, actually the unemployment in Sweden in July was higher than in Norway and Finland. So they didn't make much they didn't help much in unemployment, and they have more deaths. Now, if down the way Norway and Finland continue to have deaths or have big outbreaks in the future, maybe then the Swedish way was good. But I think when you look at it, you're going to say that the 5,000 people died in Sweden unnecessarily. But we'll see. So Laura says, if somebody has pancreatitis, can they still get the flu shot? They need to ask their doctor. Depending on what medications they're taking, they may or may not be able to get the flu shot. In general, people can get flu shots, but there may be some immune-compromising medicines you're on where you wouldn't want to get the flu shot, so they should ask their doctor about that. Now, again, for people who are really sick, it's hard for vaccines to work. So I've got a couple kids I take care of who have heart transplants, believe it or not. And they really can't take vaccines because they're on all this immune modulating medicine. And so they're not getting MMR vaccines, they're not getting other live viruses. And even if they did get a killed vaccine, they still wouldn't make particularly good antibodies to it. So the goal is to have everybody around them get good immunity so the disease won't be there to give to them. But on the story on pancreatitis, you should really talk to their doctor to see if you can get a flu shot. If you can, you definitely should. I think I have good news. I think we're going to have 3 free flu clinics over the next 2 months. probably not too early to tell you that there are going to be 2 in October at the fairgrounds, and then there's going to be 1 in November on Veterans Day as part of the Veterans Day Parade. So there's going to be some great news, I think, about the Veterans Day Parade, and I think there's going to be a flu clinic associated with that, which would be great, because we really want people to get flu shots this year to keep the level of flu low so that we're not dealing with both flu and COVID at the same time. That'll be so darn messy. Okay. Well, it looks like we're done on questions. I know people are very distracted with the fire and the smoke and everything else. I would say stay safe, stay healthy. This is not a time to be out exercising. This is time to be in the house, windows closed. If you have an air purifier, that's great. If you have an air conditioner, that's great. We think the smoke is going to be gone in the next few days, so hang tight. COVID, however, will not be gone in the next few days, so still be very careful with the things we've warned you about. Family gatherings, again, we see again and again that family gatherings, you bring 10 people together from around the country or around the area, that's a place to go ahead and spread disease. Travel to areas where there's more disease, clearly we're seeing it. So the states now associated with it. So internationally, we've had 2 from Australia, and then for states, I'll see if I get them all right. It's Alaska, Washington, California, Nevada, Idaho, Utah, Arizona, Texas, Louisiana, 2. Florida, Michigan, Ohio, and Massachusetts, and Tennessee. So I think I got what's left. And again, so much of our diseases come from out of area places, and they're generally not been like tourists coming to see the waterfalls that have brought it. It's typically Douglas County people have gone elsewhere, or other people have come to visit Douglas County people that have spread. So again, be very, very careful of those situations. So if you wanted to be careful in that, what could you do? Well, you can quarantine, or they could quarantine before they got here. That would be very safe. Or you could quarantine afterwards, because typically what we've seen is somebody comes, they expose people here, everybody goes to work, and then they spread it at work, and that's how this spreads. So be careful about that. Be careful about family gatherings. And just overall, just be safe and be kind. People have been incredibly kind during this thing. Incredibly heartwarming to be. I was at the fairgrounds every day looking to see how the shelter is going. And they have just moved through an enormous amount of foodstuffs, of supplies. They've not actually had a lot of people staying at the fairgrounds because they've been trying to get people in the hotels so that they don't spread the disease. But the Red Cross has done an incredible job of helping people. So especially during this kind, stay safe and be kind. Thank you.